I'm Larry Schlesinger here in Hawaii, and today we're going to discuss labiaplasty surgery. There are two basic techniques for labiaplasties, and by that I mean labia minora surgery. And the two techniques are the trim technique and the wedge technique. Now, the trim technique's been around for a very long time, and it's pretty simple-minded. What you're basically doing is trimming off the excess, the portion that sticks out. The problem with that is that the labia minora are very wiggly little things, and because of that, if you put too much tension when you pull up with too much tension and you trim it off, when it goes down, you're going to find out sometimes you've removed the entire thing. And so that's amputation of the labia. And the problem with that is the labia minora does have a function, and the function is to close the introitus, or the opening to the vagina. And when that happens, everything dries out. And the tissue, which is mucosal tissue, can become transitional tissue, and it's relatively rough and not very forgiving. The wedge technique was invented by Dr. Gary Alter of Beverly Hills. And Gary is a unique individual in that he's board certified in urology and plastic surgery, trained at the Mayo Clinic. And Gary, being a plastic surgeon who's done lots of surgery of all kinds, looked at the labia and said, that looks like a lot like an earlobe. And so he said, how do we make earlobes smaller? We take a wedge section out of it. So why don't we take a wedge section out of the labia? And that has turned out to be a fantastic technique, because if you want to take a bigger limb and a smaller limb, you can take little extra pieces out and make the two limbs equal. I like the wedge technique because there's really no scarring. You haven't interrupted the leading edge of the labia minora, and there's really no chance of total amputation like there is with the trim technique.